Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. A very popular drug in the management of type 2 diabetes is the drug Metformin. In addition to helping to lower blood sugar or blood glucose levels, Metformin has also been shown to lower various other risk factors for cardiovascular disease, and it seems to block important steps in the development of many types of cancer by blocking what's known as the mTOR pathway, for example. In fact, diabetics using metformin have been shown to have cancer rates that are 30% lower than diabetics using other glucose-lowering diabetic drugs. Now, these impressive findings have prompted some doctors to suggest that we all should take metformin after the age of 50 to help reduce our risk of cancer and cardiovascular disease, the two leading causes of death in our society. However, evidence published within the past decade has also shown that metformin inhibits the function of the cell's energy factory known as the mitochondria. This is where the energy is made in the cell. More specifically, it inhibits the function of complex 1 in the mitochondria, which is vitally important for the cell to be able to make energy that it requires for normal functioning. Studies show that the impairment of complex 1 in the mitochondria is a very important step in the development of Parkinson's disease, which is the leading movement disorder affecting 1 in 600 people over the age of 60. We know that exposure to the pesticides rotenone and paraquat, which inhibit complex 1 in the mitochondria, is strongly linked to an increased risk of Parkinson's disease in human studies, and animal studies confirm the same thing. Because these pesticides inhibit complex 1 in the mitochondria, even animals develop these Parkinson's-like movement disorders. Because metformin also inhibits complex 1 in the cell's mitochondria, it was postulated by some researchers that, like pesticides, it might also increase the risk of Parkinson's disease. Now, these suspicions were realized in the research results presented at the 13th International Conference on Alzheimer's and Parkinson's Disease, presented on March 29, 2017, and discussed in some detail in the Medscape article that was published on December 5, 2022, entitled Metformin Use Linked to Increased Dementia, Parkinson's Risk in Patients with Diabetes. Now, in this study, researchers followed 9,300 patients with type 2 diabetes in Taiwan for up to 12 years and found that the risk of Parkinson's disease and dementia was more than double in the diabetics treated with metformin compared to the diabetic patients who were treated with other glucose-lowering drugs during the same period. So the ones getting metformin had double the risk not only of Parkinson's disease, but also dementia. As they stated, the cumulative evidence of Parkinson's and dementia were significantly higher in our metformin cohort at 12 years. The study also showed that the higher the dosage of metformin that was used and the longer the duration, the greater was the risk of developing Parkinson's disease and dementia, especially after 300 continuous days of use or using doses that were at or above 2,400 milligrams per day, which is commonly prescribed. Now, I believe these findings are very important because as the population ages, some doctors are suggesting that we all use metformin to help prevent cancer and cardiovascular disease, even if we don't have type 2 diabetes. But this study is suggesting that it may have the negative effect of increasing the risk of dementia and Parkinson's disease, and these are serious considerations. Furthermore, metformin has also been shown to depress the immune system, which increases our risk of infections. So it should interest you to know that some natural compounds work in a similar way as metformin to reduce the risk of cancer and cardiovascular disease without increasing our risk of Parkinson's disease and dementia or weakening our immune system. Some of these natural compounds include soy isoflavones that are found in soy products and soy extract supplements, as well as in green tea and green tea extract because it contains what's known as the EGCG, the epigallocatechin gallate, green tea and supplements that have green tea extract, as well as curcumin found in the spice turmeric, also in curcumin-containing supplements. Also included on this list of cancer and cardiovascular protecting strategies should be aerobic exercise and caloric restriction, which includes intermittent fasting if you want to do that, which also inhibit the same mTOR pathway as metformin linked to preventing cancer and cardiovascular disease risk. So I've been tempted over the years to use the drug metformin as an intervention to further reduce cancer and cardiovascular risk in my own body, but the evidence pointing to an increased risk of dementia and Parkinson's disease from use of this drug has convinced me to continue to exclusively use only the more natural nutrition, exercise, and supplementation strategies that I've employed thus far. In fact, some of these natural supplements and food constituents, as well as exercise and caloric restriction, are shown to also help prevent Parkinson's disease and dementia. Not to increase it, but they also decrease the risk of Parkinson's and dementia, as well as cancer and heart disease. I'll tell you that nutrition and lifestyle medicine is good medicine, and it needs to be featured more in our overall conventional healthcare system. So I've included the references for all this information in the text below. Thanks for watching, and I'll see you next time.